In this section, we are going to be taking a look at cellular regulation. The objectives for this section, we're mainly going to be taking a look at the risk factors and prevention methods associated with skin, breast, and testicular cancer. For the student learning outcomes, we are going to look at providing safe, patient-centered, evidence-based nursing care for chronic and vulnerable populations, guided by the Caritas philosophy, demonstrating critical thinking and clinical reasoning when providing quality patient care in community-based settings, and communicating effectively with patients, families, and members of the interprofessional team. There are cancer risk factors that are associated with pretty much any type of cancer. When we're taking a look at skin cancer, breast, and testicular, there are going to be some that are going to be a little bit more heavily focused on. But you want to understand why these are risk factors, and then also how are they preventable. So the difference between the modifiable and the non-modifiable risk factors. Modifiable are things that can be changed, such as diet, occupation, sun exposure, obesity, recreational drug use, alcohol and tobacco use, and really infection, because if you have a good, healthy immune system and you're participating in activities that are going to promote immune function, you can actually decrease your risk of infection. Your non-modifiable risk factors are hereditary, age, gender, and taking a look at skin cancer for the risk factors, refer to your textbook on page 131. It's box 2-10. These are the risk factors that are mainly they are non-modifiable as far as a high number of moles, skin color, fair skin, blonde hair, close relatives with the disease. The only thing, age is on there as well, past history of melanoma. The one modifiable risk factor that can have a significant impact on prevention of skin cancer is exposure to ultraviolet radiation. So you really want to encourage, as far as patient education, the use of sunscreen and the proper use of sunscreen. Excuse me. So you want to have an SPF of 30 or higher. You want to put it on about 30 minutes before sun exposure is going to take place. You want to excuse me, reapply every 2 hours, and you also reapply if the skin becomes wet or extremely diaphoretic. Also the use of hats and sunglasses as well. As far as prevention and assessment, you want to encourage individuals to perform self-assessment of their skin on a regular basis, usually on a monthly basis, and you're taking a look at those A, B, C, D, E's. The A is asymmetry, B is border irregularities, C is color variations, D is diameter of greater than 6 millimeters, and E is actually not in your textbook, but it also applies. It's evolving changes. So if it becomes itchy, redness, anything, a change in color, those are all red flags that it's a potential for a melanoma, which is a cancerous skin lesion. Also, in the prevention is the tanning beds. There is a box in your textbook. It's on page 132. It's a safety alert, and it talks about the risk of melanoma in relationship to tanning beds. So your nursing diagnoses, they're going to be taking a look at impaired skin integrity. Knowledge deficit is probably going to be the most significant where nurses have the impact. risk for infection, if there's any kind of surgical procedures that are done to correct melanomas, hopelessness, and anxiety. Breast cancer is the second leading cancer in women, and it is the second cause of cancer-related deaths in women in the United States. So risk factors, women are much more likely. There is a genetic risk factor component in there as well, family history of breast cancer, and this is particularly with first-degree relatives, so mother, sister, and daughter, a personal history of breast cancer, menstrual history, if individuals have menstruated before the age of 12 or had menopause after the age of 55, they are at higher risk. Using oral contraceptives places individuals at higher risk. Not having children or after the age of 30, using hormone replacement therapy, those individuals that did not breastfeed, drinking alcohol, high-fat diets, obesity, physical inactivity will all contribute to a potential for a diagnosis of breast cancer. So as far as prevention, again, looking at those modifiable risk factors, encouraging physical activity, limiting smoking and drinking, diet as far as a healthy body weight is also going to impact as well. And then taking a look at the self-breast exams. And with self-breast exams, you really want to teach them, one, how to perform a self-breast exam, and then also what they are looking for. So in conducting a self-breast exam, it needs to be performed 3 to 5 days after a period starts. For postmenopausal women, it should be done on the same day every month, since they will not be menstruating. And then really what you want to have them do is either you could do circles or an up and down to cover all the breast tissue up into the axilla, and that's actually the upper outer quadrants are where the majority of cancerous lesions are found. So you really want to encourage them to go up into the axilla to make sure that those lymph nodes are not being affected as well. And then what they're looking for is any kind of dimpling, retraction, a rash around the nipple area, abnormal nipple discharge. There's almost like a orange peel consistency where it's a dimpling effect. And they want to do either in the shower with like soap and water is usually effective, laying down, but to do the same procedure each time. And again, make sure all of the tissue is felt to make sure that they're not missing any areas. And then also to take a look in the mirror and just face the mirror, lift the arms over the head, the hands on the hips, and leaning forward to make sure that there's no changes in the breast tissue. We're going to take a look at testicular cancer, the risk factors, prevention, and then the testicular self-exams. As far as risk factors, an undescended testicle places at higher risk. In fetal development, the testicles will actually descend into the scrotum before birth. If this does not occur, it actually increases the risk of testicular cancer. Any abnormal testicle development, a family history of testicular cancer. With age, it can occur at any age, but the greatest risk affects teens and younger men between the ages of 15 and 35. So that's where we're really going to want to target education. And then Caucasian men are at greater risk. As far as symptoms for what you would want to instruct when conducting the testicular self-exams, symptoms to be looking for would be a lump or enlargement in either testicle, a feeling of heaviness in the scrotum, a dull ache in the abdomen or groin, a sudden collection of fluid in the scrotum, pain or discomfort in a testicle or in the scrotum, enlargement or tenderness of the breast tissue, and as well as back pain. As far as educating on testicular self-exam, this is the #1 prevention strategy. And again, we're really going to want to target those 15 to 35-year-olds to make sure that they are doing regular testicular self-exams. So the best time is during or after a bath or shower, because the warm water will actually make it easier to feel any abnormalities, because the scrotum of the skin is going to be relaxed. So you want to instruct to hold the penis out of the way and check one testicle at a time. Hold the testicle between the thumb and fingers of both hands and gently roll the testicle between the fingers. And they're looking and feeling for any hard lumps or smooth rounded bumps, any change in size, shape, or consistency of the testicles. So if they are feeling anything abnormal, they want to contact their healthcare provider immediately. And also to let them know that it is normal for one testicle to be slightly larger and one to actually hang lower than the other. These are normal and should not be cause for an alarm. There's also the epididymis can feel like a small coiled tube by the normal testicle. Again, this is normal, and once they start to do this on a regular basis, then they will become familiar with their own anatomy. And this should be done on a monthly basis as well as the self-breast exams for females.